Hello, everyone, and welcome again to another episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and joining me on the show today is my brother from another mother, Dr. Paul Anderson. Dr. Anderson and we've known each other for a very long time. He's a fellow naturopathic physician in the state of Washington and also one of our, I'll say, primary educators in naturopathic medicine and functional medicine. In fact, I just got back from a conference last weekend in Scottsdale, Arizona that Dr. Anderson and his group put on that was absolutely fantastic, talking about mitochondrial dysfunction, which we're not going to talk too much about today. Well, we'll have to do that in a future episode. But I'm just so grateful to have Dr. Anderson here today. So, Paul, thank you so much for joining us today.
Thanks for having me. This should be fun. Yeah.
So, the title of this podcast is Resilient Health Radio. And you and I, we've been in the game a long time. And, a big population of people that we're working with, fall under this umbrella of chronic sickness, chronic illness. And it can be Lyme disease, it can be autoimmune disease, it can be cancer. And, there's a lot to be said about someone's fortitude when they're dealing with chronic illness. And I think, the first question I want to ask is, what are some of the things you've seen in your years of practice that you find that people aren't aware of that might keep them in a sick condition? And I don't want to imply that we're blaming anybody for being sick,
Right.
but, in naturopathic medicine, we understand that the body has the capacity to heal on its own and that these obstacles get in the way and stop that process from happening. So what are some of the key things that you've seen that are those obstacles?
Yeah, I think that's the best place to start really because, like you and I see every day, human nature, we want something to blame when we don't feel well. And in a simpler model, if we have break our arm, we kind of know what happened, right? Or if we get strep throat. But with chronic illness, what happens is whatever the inciting problem was might still be there, might not still be there, but our body kind of loses its way on the healing pathway. And I think that there's a couple of layers, but the first one, like you say, you never want to blame it. It's not really our fault when our body loses its way. There's other factors, but one of the things that I've come to notice for a long time, but really crystallized in the last few years, is if we're chronically ill and we're not really getting better as we want to, or on the schedule we want to, the first thing is that we lose our empowerment. So, our ability to have self-agency and be an empowered patient and all of that. And people will sometimes think, well, I mean, I don't remember losing it or what happened, but what I think goes on, because I've seen this with the chronic illness space, but also my cancer patients, is you don't realize that you're grieving the life that you used to have, which was
Right.
healthier, you know? And when you kinda come to grips with that, you can process through that, and literally, it's like grieving a loss. It doesn't mean you have to keep it lost, but there's very good research that shows when we become empowered patients, medical treatments work better, our quality of life improves, we probably, heal faster, etcetera. And I only bring that up first because a lot of us don't realize we're actually grieving something that, may have been a few years ago or maybe been many years ago, which is our health. So I think that's one that's really potent because it happens slowly and we don't realize how, kind of unempowered we can be. So I think that's a big area. Um, I think the other is, our body has this amazing ability to heal itself, because for long before there were a lot of doctors, we were able to heal ourselves from most things. But in modern times where we get so we can keep ourselves alive so much easier with, with drugs and chemistry and all sorts of other stuff, the immune system and the body's healing powers to kind of go back to the center get confused. And I think what we see in our chronically ill people is the body has an image of normal that's actually not normal now. So it's kind of keeping us where we're at. And that's another thing that's, just like kind of becoming empowered. It's more like becoming biochemically empowered to reacquaint the body with, no, this is health over here, and we want to try and push back that way. Which the longer we've been chronically ill, it's baby steps, to get back there. Which is why it frustrates people. I think, I'm sure you see this every day, where they'll say, well, X infection started this, whether it's, the Lyme family or the HHV family or whomever, or, this toxicity started it or whatever, and we're working on that. Well, why isn't that making me all better now? Well, it's because to deal with the infections or the toxicity or whatever, our body had to, we're not going to hopefully die from it. Our body has to kind of pick a new normal to say, this is as much energy as we have now, and we're just going to keep going here. So I think those are areas, they're very subtle seemingly, and they're not what we think we're looking for, which is, if I could just kill this one infection, my life would be better. It, it can be that easy, but usually it's not when we've been sick a while. So I think those are things. And uh, I'm sure, you've kind of struggled with this dealing with patients. It's coming to that realization sometimes is not a very uplifting and happy time, because you're essentially saying, look, we have more work to do here than it seems. I guess, folks like us, though, who were the seventh or eighth or 20th doctor they see, they kind of know there's maybe more going wrong. So I think those are things at the real base with chronic illness.
Yeah, I think one of the things I've seen a lot of my practice, and I know you have as well, this persistent infection, and again, it can be anything from Lyme to a herpes virus to, whatever else. And it's just, I don't know. I was a clinical microbiologist before I was a doctor, and the longer I do this, the more I keep thinking about, how much of what people experience is truly the infection versus the immune response to the microbe versus, perhaps some other mechanism related to that organism. I mean, I think, the idea of germ theory is kind of slowly eroding as time goes on. I mean, I think COVID was a great example of this, just that we saw people that got a sniffle and people that died. We had these very polar extreme reaction. If we agree it's relatively the same virus, at least at any given time, what is it about the individual that allows these infections to become so persistent?
Yeah, I think that's an excellent point. And you know, one thing I would try and characterize with patients is, it doesn't mean that the infections have no impact on you, especially if there's still some hanging around. But by the time you become chronically ill, usually there's multiple other pathways that have been, either turned on, or things you didn't realize were a problem for you. Your threshold is much lower now, and now they're a big problem. And so you have to kind of look at it as, as a holistic issue with the person. And I do think, not that certainly we would have chosen to have, COVID, but I think what it's done is it's put this idea of individuality and individuality of response to a microbe uh, in different perspective, because it's obvious to everybody, why did one member of the family get so sick or pass away? The rest of the family had maybe little to no problem or medium, or why did a group of people that we now see, maybe with long COVID, part of them felt like they were super healthy before, and
Right.
then encounter a virus and suddenly they're chronically ill. That just doesn't make any sense. Well, I think what it did is it sort of took the lid off the fact that we every day, even when we feel super healthy, we're exposed to all kind of things that aren't good for our health, especially in modern times. And yeah, for some people, you get a big infection, that's enough to bring it all crashing down. But for some people, it's, I've been putting up with my exposure to mycotoxins or other toxins, and I don't feel it because, I got good vitality. Suddenly, then I have, COVID or Lyme or whatever, and now my immune system has no energy, to put up with all the toxicity or, immuno inhibitory things like mycotoxins. So suddenly, it's all a huge deal, you know. Or maybe, maybe I had hormonal things. I'm getting along. I'm not having big symptoms, but my hormonal system auto regulates and it's been auto regulating in a downward trend. And suddenly I get sick enough with something else. And now, as if overnight, my hormones aren't working anymore. All these things. I've seen this happen as you have with post COVID people, but really, what we see, it's no different than our Lyme patients or our, fill in the blank.
Yeah, I think this is where conventional medicine tends to uh, short people, in that when you've got this complex level of illness, and if you're get your 7 to 10 minutes with your primary care provider,
Yeah.
it's one problem, one solution.
Right.
And the reality is you're probably dealing with multiple problems and you might need multiple solutions.
Yeah.
So, I guess this is where perhaps naturopathic medicine, functional medicine might supersede conventional medicine, which is really effective at heroic medicine. My goodness, if you break your arm, please go to the ER. They're great at that if you
Yeah.
need surgery and that level of
Yeah.
intervention. But for so much chronic illness, well, I think what stops a lot of people from getting well is just time, the time you need for someone to really sit down, evaluate you as an individual with your level of complexity, and do that detective work and trying to sort out what is it for you that's stopping you from get well.
Yeah. Yeah, and I do think that's, that whole phenomenon of, the acute care model of medicine has evolved to the place where it's perfect where it's supposed to work, which is keeping us alive when bad things happen and acute problems, etcetera. And although those of us in our end of medicine know this forever, COVID is now showing us that that model really can't be applied to a chronic illness. It's just not gonna work, and so you see, even big academic centers where they have post-COVID clinics and everything, they're trying the best they can, but they're trying to do it with this, single agent theory or at best a couple of things, and their people are frustrated because A, they wait forever to get into the specialty clinic, and then B, if they don't have an organ problem, thank God, they're given a few symptomatic medications and then hopefully you get better at some point, which we've seen with chronic fatigue and fibro and Lyme and everything for forever. So I do think it's, but then it's frustrating on it can be frustrating to the doctor, but it's frustrating on the patient side to realize, oh, there isn't an acute care model to make this better. It's not like I know my arm's going to be 6 weeks in a cast, or I got a week of antibiotics to take for my strep throat or something. This is going to be a process because you have to unwind all that. And I think that's another thing that becomes it can kind of take away from your agency and your ability to be an empowered patient because you just feel like, "Oh, I don't want to do this. Um, so that's when that relationship with, provider and patient, half of it is just keeping both engaged and realizing we're moving forward, slow as it may be. Uh, but you're not being cut loose and, you're not being told, well, that's all we can do, et cetera. So I do think that's a big factor.
Well, I think you bring up a good point too about healing, is that it's very individual and the process can vary from person to person, and there's really no set time. I mean, we all get asked as healthcare providers, when is this going to change, when to expect, and we might have a general framework, but some people heal quickly and some people heal very
Yeah.
slowly. And I tell some people, it's like it can be like watching grass grow. I mean, it does grow. It's just
Yeah.
day to day that increment's so small.
Yeah.
You live in your body every day. You might not be as aware, depending on how much kind of in touch you are with your body. But I see a lot of people where you know time goes on. Often it's a course of months where say, well, how are you feeling? I don't really feel any better. Oh, well, do you still get the headaches? Oh, well, no, no, I don't get headaches anymore. Well, what about that ankle pain? Oh yeah, I guess I've been back jogging again. It's like, you forget because the time frame is
Yeah.
so slow and long that, it's easy to kind of forget, because the goal is you want to feel 100% perfect.
Right.
And even if there's 25 or 30% improvement, because you're not perfect yet, the brain sometimes says, well, I'm not better. I'm like, well, you're not
Right.
100% better.
Yeah.
But it's important that we both recognize that the body is healing in a way, and it is moving in that direction. So I
Yeah.
just think that's important for people to understand that you can't
Yeah.
compare yourself to anybody else when it comes to healing.
No, because, chronically ill folks can get unwell in so many combinations of ways. And how you unwind that is your own, it's your own pathway. And another phenomenon I've seen over and over, which after a few years I got smart enough to warn people about, is as these things start happening, where you're watching the grass grow, but you're subtly getting better. So maybe some of the orthopedic type things or, connective tissue pain stuff is getting better. What I really would see is people would improve, 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 then they'd flatten out or have a little reversal, and that's when they get worried. But usually the reversal isn't anything new. It's just I don't have this problem so much anymore. My body's stronger. It now has energy to focus on this other area that was broken. And so now, I've got symptoms there, which may be more my immune system or more, whatever other area. So I always tell them it's more like a roller coaster, but the trend is up. So that's what we want. Little reversal just means maybe we need to focus on new things, but it's not going to always go down. It's better over time. And I do think because people will often, when you're not feeling well, you just want to feel better. You don't want to think about all this stuff. But the way your body works is once I lower the burden of area A and get it working, then all the other areas have that energy now to focus on, I've got trouble over here, area B, C, and D. Let me give you some symptoms to work on here. So I think we see that a lot. Yeah.
Yeah, probably more than we would care to.
Mhm.
I want to shift gears just a little bit because I know this is an area of expertise. And again, kind of coming back to this idea of chronic infection, particularly chronic bacterial infection, we
Mhm.
know that a lot of these bacteria can make this stuff called biofilm. Can you tell us a little bit about what it is and why is it potentially problematic?
Yeah, I think the first thing to start out with, because it's true and people point this out, is so biofilms are all over in nature. They're big in oceanography, wet areas, of course. And biofilms are just a way for organisms to protect themselves in their environment. So, the first described ones in humans were on our teeth, which can lead to dental issues, et cetera. But really, throughout our whole digestive tract, to some degree in the vascular system and connective tissue, we can have biofilms. And the way that I try and explain it to patients is there's sort of uh, three types in a spectrum. You have the normal kind, and that's very much like we have normal bacteria, there's normal flora, it's supposed to be there. Well, there's some normal biofilms that are just part of life, they're just part of our ecosystem. Those aren't a problem. But when we get, and it's usually a bacteria, normally something that we already have in a small amount, like in our digestive tract, like you might have Pseudomonas or one of these others that are known to create biofilms, and they're fine. Like they're marginalized, they're just in tiny amounts. We consider them low level commensals. But when we disrupt things, which could be a bunch of antibiotics and, we get overgrowth of the wrong thing, or we just get really sick and run down, or we get exposed to mycotoxins that sideline the immune system, something happens. And these guys either are introduced to us or that usually they just overgrow because they can. And then they do their thing. And one of their things is they make biofilms. Well, the comp the complexity is now they're not part of our normal flora and normal ecology. They're growing. I always tell people, from like a tent to a stick house to a big building. The longer they're allowed to do it, and it can be with no symptoms, which is frustrating. Not only is it now a biofilm for that one organism, but they invite others into the biofilm. And to make it more complex, the modern biofilm researchers say now it's like you could have 10 different organisms of all different types. It could be virus, fungus, bacteria, parasites, everybody living in there. They now function as a different organism, which is the sum of all of them together. So a frustrating thing is a patient finds, a bug that we know is bad and we try and kill it. And maybe the test turns negative, but they're just as sick as they were before. And it's because whatever we did to kill that bug didn't kill any of the other guys. So, and they also can share they can share DNA in there. So they if they have resistance factors, or they work together. So the biofilm is from the microbes perspective, just protecting them, and they're having their own, increase in strength in the host, which is us. So the other layer of, dealing with them, because if you look, anthropologically at humans, we've been around a long time. Why, let's take modern times with all the toxins and other junk we have to deal with out of it. Why would biofilms kind of be fairly stable in humans over time and maybe in modern times not? Because that to the degree that prior to COVID, I think it was one of the government agencies that deals with health, I'll just say that, listed listed biofilms as one of the major, health crises of the new millennium. And so why suddenly is this such a problem? Well, if you look at and if you look at indigenous diets prior to modern times, regardless of where you were in the world, what you find is the indigenous diet evolved in a way where they would use native plants, herbs, spices, those sort of things, because it makes the food taste better. Turns out, and it doesn't matter what part of the world you look at the indigenous diet, those plants are also anti-biofilm formers. So as long as you're sort of keeping up with it as you go along, that diet and those spices and those herbs actually would keep you from forming a whole bunch of biofilms. And turns out they would also keep your microbiome stable. Well, if you look at industrialized Western diet from, you know, 80, 100 years ago till now, most of it lost all of that. Plus, the food is not food. Um, and
Sadly.
then, then you add, antibiotics, and then you add, things that we might need now and then, but it's sort of like it's a lot easier to push the modern human over the cliff than it used to be. So then it comes to this place clinically where, you and I get the patient and it's like, oh gosh, look at this test. We got these two bad actors, which we know are, bad microbes. Uh, we know how to kill them. So you go after killing them. And then it's sort of like it just, some people call it like playing whack-a-mole or just trading places. Those might get weaker because we treated them, but then their friends that we don't know about still create the same problem.
Right.
And as you know better than I do, being a microbiologist, I always tell patients, for every one bug we can find on a test, there's 20 to 100 that are related to it that we have no idea how to locate, So it's not like, and again, human nature, we would love to make one bug really bad. And if we could just kill it, that makes us feel better. But when you're chronically ill, the biofilms play into this resistance and other things. And then there's this other more modern last 15, 20 years, which really our military has lots of money for research, and they really push this research forward, which is not all biofilms are created equal. And when you look at, dirty wounds, post-surgical wounds, and also chronically ill people, they have a much, these are the skyscraper like biofilms. They're much more complex, and there's many more organisms in there, and they just take longer to deal with. So uh, that's hopefully the Cliff Note version of biofilms, but they're really a big part of modern chronic illness, I believe.
Well, we know something like Lyme is also very effective at making biofilm. And I remember reading a
Yeah.
study, and I forget which organism, it might have been Klebsiella, but when biofilm was present, they had to give 250 times the amount of antibiotic to kill the bug than
Mhm.
when biofilm was not present.
Yeah.
So I think the clinical relevance of this is that if we can strip away the biofilm,
Yeah.
we're exposing that organism to antibiotics, antimicrobial herbs, whatever you're using
Mhm.
to try and get the bug under control. And we potentially give the body that opportunity to go after it more efficiently when we can strip that biofilm away. Now, again, as a microbiologist, I would say, look, biofilm again is a normal part of a lot of bacteria. So it's not like you don't want to have no biofilm
Right,
because that creates a
right,
different kind of problem.
right.
But it's
Yeah,
kind of like we want to break it down a little, just not
right.
100%.
Yeah, and I think that's a very important piece. It's sort of like our normal microbiome, we don't wanna destroy that either. We sometimes there's some friendly fire, and we have to rebuild the microbiome, but we want that normal human, symbiotic biofilm that we all have, and I think in reality, because, you're dealing with humans, I don't think there's ever a point where you would degrade the actual base biofilm. It's the pathogenic, and you're probably never degrading them to the point of being totally gone either. It's more bringing homeostasis back. Um, but, clinically, one thing, because the biofilms, if you're not a microbiologist, are kind of a weird concept. I would often tell clinicians, okay, you've got some stool testing or something, and you had 1, 2, 3 hits for bacteria. Just put into the search bar that bacteria and biofilm as a search agent, and it will tell you right away how good of a biofilm former it is, and most of the ones we find are small, medium, or large biofilm formers. So, again, it's those are in everybody's body, even the big bad ones, but they're in tiny amounts, like
Right.
Clostridia. It's when we throw our microbiome off, or we've got mold or other toxins that are shutting our immune system down, or our diet's horrible, they just overgrow, and they do what they do, which is make a biofilm that everyone piles on, and you've got a new problem.
Yeah, interesting. When I worked as a microbiologist, when you culture out bacteria on a plate, you basically take your sample, you streak it out on a plate that has different types of agar, which is kind of like gelatin, and then you flip the plate upside down before you put it in the incubator. Well, Klebsiella, you can tell the minute you pull it out of the incubator because it looked like someone blew their nose on the bottom of the plate. It creates so much biofilm on a plate.
Yeah.
Literally, it drips from the plate down to the bottom of the petri dish. So, I mean, we used to laugh. It's like, well, we don't even have to run any tests. You know
Right.
exactly what it is just from the amount of biofilm that's accumulated in the plate before you even run any kind of analysis.
Yeah.
So,
Yeah.
because this is, again, part of your normal gut flora, you can imagine when that starts to overgrow, its potential to create more biofilm in the gut, that can create different types of gastrointestinal
Yeah.
issues. So I
Yeah.
guess the $1,000,000 question then is, how do we treat these biofilms? What can we do to help improve the efficacy of our antimicrobial therapy?
Yeah, and I think, when I started to consciously use biofilm agents, in a more, thought through therapeutic manner with maybe anti-infectives or probiotics or whatever we're doing, it made huge differences in people with, higher level, dysfunctions. And it could be, we saw a lot of changes in children and, pandas, so it doesn't have to be an older person if they have a big problem, but especially chronically ill people, been sick more than 5 or 10 years, there's big problems. So, when you look at there's the sort of homeostatic things that could be in our diet and were traditionally, which are mostly aromatic herbs and spices and things. Phase 1 biofilms, maybe the tent size or a small house size, aromatic herbs work really well there. If you look at the lists, you mentioned earlier higher doses of, say, antibiotics and things. That certainly
Yeah.
is one way, but sometimes not compatible with the human. Um, but then aromatic herbs are very, very useful in that setting. And the thing I always liked is if they hadn't grown to the big bad biofilms, aromatic herbs also are anti-infective across a real broad spectrum. So opportunistic fungi and some of the bacteria and, even some viruses, a lot of the aromatic herbs will just tamp them down. So it's always worth starting there. But in
Can you just,
people,
I'm sorry, Paul, can you just
yeah.
explain to people what aromatic herbs are, which ones that
Yeah,
you're
so, literally it's not an official taxonomy, but it's all of the ones that really you can smell. So when you, when you look at aromatics, you think of like oregano, literally probably one of the most broad spectrum things, thyme, um, all of the, you know, any herb that you, if it wasn't in a capsule, and sometimes even in the capsule, you would have an odor to it, and it's because the chemistry of it is, there's more aromatic chemistry which our nose will pick up, which is hence the smell. So really broad spectrum things, like oregano oil and thyme oil, and uh sometimes olive leaf fits into this. There's like a lot of herbs that we smell. Interestingly too, when people see the list, it's often a lot of culinary herbs that are used.
right.
They're
Yeah.
at higher concentration. So that's that group, and probably without even knowing it or knowing a lot about biofilms forever, we've thought of those as, pretty gut friendly herbs, but also pretty effective at reducing the amount of a bunch of microbes. But it turns out they probably also were beating up on the biofilm. What the and I'm blaming the military because they spent the most, money on this. But what the military showed us in the last 25 years is there's a step beyond that. Usually, if you have either a big trauma, surgery will do this, and also just sick a long time. And that's where they get too big for antimicrobials to get through, or aromatics, or anything else. Uh, and so then you actually have to have agents that literally kind of wedge themselves into the biofilm matrix so the immune system then can see what's going on inside. So when we think of like a lot of biofilm therapies in modern times, definitely the aromatic herbs are a big core of that. Also, there's enzymes which will help disrupt the matrix. Um, Sometimes people use like a chelator, like EDTA, and some of the supplements. All of those kinda get you to that phase of the first bad group, the phase 1s. Phase 2s, those things are helpful, but the matrix is so much thicker and bigger, that's when more complex molecules seem to work better. So, all of the big research of the last 20 years has looked at, bismuth, like in Pepto-Bismol, that's one form of bismuth. They use a little stronger version, and then a thiol, like sulfury things, or like N-acetylcysteine. The supplement smells like, sulfur because it's got a lot of sulfur in it. Alpha
Right.
lipoic acid, those are thiols. And then, like, you and I might use a more complex thiol that deal with heavy metals like DMSA or DMPS. They're actually chelators. And for a long time, I think before this research was really well worked out, we would see people do like an oral chelator for heavy metals purportedly, but they would suddenly, either for better or worse, get GI symptoms.
Yeah.
And a lot of that was the biofilms are suddenly opening up. And so what I learned, maybe a little bit the hard way, once sort of realizing this, is when you get to these heavier agents, whether it's a diethyl chelator or a thiol and a bismuth stuck together in a new drug or something, you have to be very close with the patient as far as, look, if part of the problem is the big biofilm been there a while, and this even in kids with pandas, we saw this, as soon as the your immune system sees those organisms, you got to keep in mind it hasn't been seeing them before. Your immune system reacting suddenly can be very shocking. And so people get very inflamed, or if their adrenals weren't ready to pump out enough natural cortisol, they might crash really bad or get really inflamed or depressed or something. So we would always say we'll see if we're moving that way. If your body has a reaction, that's when, very effectively, like those broad spectrum aromatics, like, oregano and thyme and things, very helpful. And then usually a lot of adrenal support because you get this sudden immune burst, which then calls on your adrenals. Chronically ill people don't have a lot left with the adrenals, so you might have to, boost that up. But it's very clinically apparent when it happens in my experience. And it could be, you could be having used, the more gentle biofilm agents, and you kick it up to something else, and suddenly, boom, you've got these symptoms. And it's not, people equate symptoms with something's gone really wrong. No, it's just that, it's sort of like, hopefully someone listening has seen Casablanca, where the police prefect goes in and he's just won all this money gambling. And he says, I'm shocked to see there's gambling going on here, Rick. It's a lot like that with your immune system. It's like, oh, I'm shocked to see all these microbes around. And the immune system does its job. So big reactions, you can deal with them, but that's usually a sign that you had a bigger problem.
Well, again, it's an important part of a lot of my treatment, plans for people is, when we're dealing with chronic infection, we might be using targeted herbs, maybe even antibiotics, but having something to help break down that biofilm often, helps expedite the process of getting through that persistent infection a little easier. And again, I like a lot of the products out there. I know you have a product you developed, I have a product I developed, and there's numerous other ones that all effective at helping strip that biofilm away. And again, it's just a nice addition to your plan if you've been dealing with chronic infection. Again, just because so many of
Yeah.
these organisms are biofilm producers.
Yeah.
And again, it's just one easy thing that, again, I find most people tolerate pretty well.
Yeah. And I do always tell people, because you can get anything online anymore. If you've been sick a long time and you're just in the beginning of maybe dealing with biofilms, this is a time to be very close with your provider and make sure they can respond to things that might come up. But the other upside is, however bad they got over time, they can get better in reverse order, and they can be more
Yep.
manageable. So it's not like you're, doomed. It's You just have to get them opened up, get the immune system interacting, and maybe some agents to kill them, and some support for the body. And then it's sort of like, if you go from big bad ones, they can go down to little bad ones, and then maybe back to the normal ones. So that that's always the goal.
Well, as you all can hear, this is why I enjoy talking with Dr. Anderson. Always a wealth of knowledge and just a great educator. And I want listeners to know Dr. Anderson has a great YouTube channel, and I'd love to direct you there. So we're going to drop the link in the show notes. But
Thanks.
he's got so many great videos on topics on really just about everything. I always appreciate Paul for being the consummate learner and educator for doctors and for the public. Dr. Anderson, is there a specific link to your YouTube channel that you can say, or is it long and we should just spell it out for folks?
I think it might be easier for them to just get a link from you.
Okay.
It's under just Dr. Underscore A online, so like Dr. A online. But that can lead to many things that aren't me. So let's give you the real link and go from there.
All right. Well, we'll make sure and drop that link in. So definitely check out his YouTube channel. Take advantage of all that free information. And I think you're going to find it very educational and helpful in your own healing process. So, Paul, again, I really appreciate you spending time with us today and joining us on the show.
Thanks a lot.